Well, we try to use evidence-based techniques. So we try to look at what's triggering the anxiety, maybe, and reframe some of their distorted or negative thoughts that are causing it through therapy. We may give them some homework, in terms of to try to change their behavior and to notice when they're anxious. And if we need to, we will refer to Brenda's side of the house, and she will look at whether medication may be needed. We're also working on trying to get them to slow down and either take some time for themselves, maybe meditation, in terms of looking at what works for them to calm them down.
I teach them really on the spot, 1-minute meditations. Just let's do a minute meditation. Do you know how to do deep breathing? And they don't. Most of the time they'll say, well, I don't know what you mean. So a lot of times it's just making them stop, be present, close your eyes, and do a minute meditation. I talk them through that so they can do it if they're at the library, if they're about to take an exam, if they're in their car and they can stop their car. I really think that is so meaningful. And really, truly, meds are the last resort.
Being in the Wellness Center is so vital to what we do with students because we have a dietitian, who can work with nutrition, and we definitely recommend exercise as a regular coping mechanism for anxiety and depression, and so we have that facility here as well. So we like the comprehensive nature and the care that we can give.
And those healthy lifestyle things that we do for all prevention of illnesses are so important. Good nutrition, like Darci mentioned, adequate sleep. Sleep is a huge issue for college students. So we try to help them promote healthy ways to sleep. Exercise, getting outside nature. Nature is very connecting for many people, kind of even in a spiritual, meditative sense. So a lot of times, a day like today when it's very cold out, it's hard for people to do that. But they need to find things that they enjoy and to get it in that quiet space away from all the anxiety, stress noise that we hear, in our heads sometimes. And I think just also having the intention to be positive makes a big difference too. So I think it really is about healthy lifestyle.
I think the not sleeping for maybe 3 nights in a row is generally a sign that you should get help. There's usually like a lack of concentration, whether it be when they're trying to do homework or in class. And also mood swings are a warning sign as well.
And the other thing I think that goes with that, I totally agree with those, and where someone just really can't function. They just really, their head gets so full of this stress and anxiety that they get to a point where they can't think straight, they can't get themselves to class, they're tearful, they don't, their heart, they might be having physical symptoms where they have like heart pounding, clammy hands, and they just really don't know what to do. So I think that's really, to me, crisis time with that anxiety.
Just that we're here, we're available, we try to incorporate all facets of wellness and work, to find a balanced life.
And I think just to remember, it's so simple, we can all take a moment to do some deep breathing and meditation no matter where we are. And it can be just as simple as that, just to remember to breathe. And so I guess I would say that's my personal 1-minute, quick thing to help you cope with your anxiety and stress.